Hello everyone, this is Gopika illustrating about hepatitis B on the theme Palaxis. Being the most important type of viral hepatitis, hepatitis B virus is known to cause serious complications of the liver which includes hepatocellular carcinoma. The blood-borne virus is transmitted by parenteral transfusion of body fluids from carriers, which even include shared needles and personal articles. Carrier mothers could transmit either congenitally or vertically, where the risk is high with sexual acts. On entering the body, the virus reaches the hepatocytes where the surface antigen on HBV binds to the bile salt transporter termed sodium taurocholide co-transporting polypeptide, that is NTCP, which enables the viral DNA to infect the hepatocytes. The incomplete viral DNA then enters the nucleus where the viral DNA polymerase repairs the gaps in the plus DNA strand, forming a fully double-stranded viral DNA, which also functions as reverse transcriptase. Followed by transcription and translation of viral DNA, 4 different antigens are produced from respective viral mRNA for the packaging of new viral particles. The infected hepatocytes are cleared by the immune system. Thus, immunocompromised patients and infants are more likely to become asymptomatic carriers or may progress to chronic liver disease, while reactivation causes carcinoma. 1 to 6 months is the incubation period of the virus. Initially, fever and vomiting develops, later jaundice occurs. The series of emergence of hepatitis B viral markers in the blood is the base of specific diagnosis. Soon after the infection, even before the elevation of transaminases and onset of clinical symptoms, the surface antigen HBsAg appears in the blood and remains throughout the ectoric or the acute phase of the infection. In about 2 to 6 months, it becomes undetectable. Then its antibody anti-HB appears and remains detectable for longer period. As the capsule antigen HBcAg is enclosed within the viral coat, only its antibody appears a week or 2 weeks later after the appearance of surface antigen, and this anti-HBc remains for a lifetime. During the acute phase of the infection, IgM anti-HBc appears, while during the remote phase, IgG anti-HBc becomes predominant, which enables the prediction of the stage of the infection. The envelope antigen, an indicator of active viral replication, appears soon after or concurrently with the appearance of surface antigen and then disappears with the fall of transaminases levels in the blood, and then appears the antibody for this envelope antigen. General prophylaxis would include avoiding multiple sexual partners, injectable drug abuse, indirect or direct contact between body fluids of patients and carriers, cautious screening of body fluids and organ donors, and disposing syringes safely would help to an extent. We have very effective passive and active and combined immunization. Notably, the hepatocellular carcinoma caused by the HBV is the only human cancer which could be prevented through the vaccine methods. For the passive immunization, we have hyperimmune hepatitis B immune globin HBIg, which is prepared from the plasma of human volunteers with high titer of anti-HB. When people get exposed to the infection, this HBIg is given through IM, which protects against the illness. For active immunization, we have hepatitis B vaccine, where genetic engineering is done to isolate S gene and cloned using Baker's yeast to get HBsAg particles alone for the vaccine. Full course involves 3 doses given at 0, 1 and 6 months. In combined immunization, we administer both HBIg and HB vaccine as a single shot, recommended to the unvaccinated people exposed to the virus. This includes babies born for carrier moms. Inclusion of hepatitis B virus under the National Immunization Schedule enables us to provide the vaccine at low cost of Rs 250 to 500 in India. Treatment in case of chronic hepatitis B viral infection in adults, tenofovir alafenamide is recommended. In case of acute infection, entecavir, which is a nucleotide analog, TDF, and PEG interferon are recommended as a monotherapy or in combination with other antiviral drugs for children above the age of 5. Stay safe. Thank you.